We think about this every day. We work on this every day. Our concern, of course, is to keep our prison staff safe and the prisoners safe. I can tell you from having involvement with prisons going back to when I was George Voinovich's lieutenant governor that people who work in the prisons, they're unique. And they're unique. They are in there every day. It takes a special person to do it. And their goal is to keep the prisoner safe, and their goal is for them to be safe. So that is our goal. Director Annette Chambers-Smith reports to me often on this. She and I talked several times today about it. She not only is a very experienced person working in our prisons for many, many years, but she also, her area that she's worked in before she became director included a lot of work in the area of the health within the prison and the medical, how you deal with the medical situation in the prison. So they instituted some time ago a practice of checking on every employee who comes in. And they follow a pretty rigorous protocol. And I asked the director to kind of give me a summary. Let me just read a little bit of it to you, if I could. Every member of the department has been encouraged to stay home if they're ill. They've all been made aware of the symptoms of COVID-19 to make sure they do not come to work if ill. We started screening all department staff on March 11th. Before entering the prison, staff are screened using a questionnaire developed using ODH and CDC guidelines. That screening form requires a temperature to be taken. Takes into account travel to countries with a travel advisory as noted by the CDC. Direct contact takes into consideration direct contact with a person known to be infected with COVID-19, and also any symptoms such as fever, chills, cough, and difficulty breathing. And she goes on to talk about this particular, we have, as you noted, we have one member of the staff who has in fact tested positive. On Sunday, the director continues, we were notified about 3 p.m. that a staff member tested positive for COVID-19. As soon as we knew we had a positive staff member, we implemented an ODH-approved risk assessment form that takes into account exposure or contact with the staff member who is positive, as well as any symptoms the individual is experiencing when the risk assessment is done. So they're now going through the process of, as we always should, is looking to see who that staff person has had contact with. Several people have been actually sent home. At this point, she goes on, 5 staff members had no symptoms, but were told to self-quarantine for 14 days. 4 staff had symptoms. They were also told to quarantine. Then they were to go to their physician and go with guidance from the physician. I've also asked for those individuals to be tested, and that is going to take place. So these are all things that the prison is doing. We're implementing the same thing, or not implementing, we have in place the same thing at the Department of Youth Services for our younger people, juveniles who are in state custody. We've also implemented similar protocols in our psychiatric hospitals, and anything basically that the state is running, we are following this. Is it a concern? Absolutely. It's absolutely a concern whenever you have a significant number of people who are together, whatever the circumstances, that is a concern. And the director is, I think, doing a very good job. Her team's doing a good job, but it's always a work in progress.